Hello and welcome to Wave Clinical Support. I see from your case that you have a patient that you fit in Gasper multifocal lenses and you're struggling a little bit with comfort as well as over-refraction. Well, let's take a look at your designs for a moment. I'm first going to pull up your right eye. This is the original design, and I believe this is your second design. We'll put them side by side here. The first design, from your note, appears to have been sitting a little bit higher on this patient, and there was some over-refraction to contend with. The second design, I see that you snugged up those outer edges to see if you can get that lens to center better, and it sounds like from your clinical request that the lens is more comfortable, but I anticipate that you still have some comfort issues. Well, looking at the design, what I'd like to see happen is just a little bit better alignment in this area. This area tends to be, if you recall, the area that is the most corneal interaction with these lenses, and that's where most people get their comfort from. And so this lens here is probably a little on the looser side. This one here might be a little snugger. You got this little bit of a downturner. And if we go back for a moment and talk about Wave software, you may remember that the axial designs tend to look tend to align very closely with the central part of the cornea, and the outer peripheral part is probably less of an accurate depiction of the cornea. Whereas tangential is just the opposite. Tangential tends to be a little less precise in the center, but tends to give a pretty nice representation of the outer cornea. So when in doubt, if I have patients who I can't get comfortable enough in the axial design, I'm not afraid to switch them to tangential. And from my own clinical experience, although I'm really successful with axial designs, I find that quite often if the comfort is there or the awareness is there, a lot of these patients do better in a tangential. So you have to kind of use your clinical experience on that one and kind of experiment a little bit. But if we look at your design here, the right eye, what I would probably do is try to get this a little bit better in alignment. So I'm going to go back here and redesign this one. Give it a moment for the numbers to calculate. I'm going to pause it while it's calculating. Okay, welcome back. And you can see now we have a lens that's pretty nicely aligned in through these areas. And if you'd like, you might want to snug it up a little bit. You can bring this down and through here. What I try to avoid is I try to avoid those downturners like in through this area. We like to keep that up a little bit. If we can, get it more nicely aligned in through those areas so we don't have those areas digging in. That may help keep it more aligned. A couple things you can do too to make this lens center better and drop down. Increase the center thickness a little bit. Maybe go up closer to 20, 21. And we reduce that edge thickness. That'll help redistribute the weight of that lens to kind of pull it down a little bit more. And then you have a lens that's, I think, will align a little bit more nicely. If you're still struggling with comfort issues, I'm not sure what the patient's previous history is, but if they've worn a soft lens, you might even consider going to a semi-scleral lens at about a 14 diameter. I find quite often those are very comfortable lenses for patients who have awareness with a traditional 10 to 11 millimeter lens in the eye. Also, if the patient previously wore a Gasperm lens, try to keep that diameter to no more than about a half millimeter larger than the previous lens. And so this lens looks nice through here. Don't forget, if you're going to add your over-refraction data in, do it through this portal right here. I think on the second design too, you lost a little bit of the reading. I think your original design you had a little bit right on the pupil size. And while this is pretty nice, I think more your difficulty may be just keeping that lens centered in front of that pupil. So I'm hoping this design will help work a little bit more successfully for you. If we go over to the other eye for a moment, take a look at your left eye. This lens you have about a diopter of, not quite a diopter of corneal cylinder. And what I find is if we're having a little trouble with lenses staying centered, I tend to like to do a lot of these multifocal lenses in G-SIM, even if there's not much corneal cylinder. Because what you'll notice if you look at this lens, you have a little bit of standoff. Although it's a pretty nice looking lens, you want these lenses to be as stable and as minimal movement as you can to maximize that central zone. This one in particular, I have a little smaller anterior optical zone, so it's very important that you keep that lens centered. So I would probably tend to put this lens in geometrical G-SIM design, and I'll redesign it. I'll pause my video while that's calculating. And now that we're back, you'll see we have a lens that's very nicely centered in all meridians. I would anticipate this lens would be less likely to slide around because you have a nice alignment in through this meridian. I would anticipate the lens to be a little bit more comfortable. I think I'd probably bring up this edge lift here just to make sure we have enough of a tear pump to maintain the comfort of that lens. I think that'll help this lens stay more centered. The over-refraction that you had, I'd be a little careful in this left eye. Your over-refraction may possibly represent some of that ad coming through if this pupil's not centered. So I would work on getting that centered, be careful, be kind of cautious on the over-refraction. If you have any data from their previous gas-perm contacts, if they wore any, if you recall, there's a great tool in here called the Trial Lens Data Tool where you can enter previously known gas-perm lenses with the over-refraction. That'll help fine-tune that overall power if you're getting too much inconsistency here. Also, just a general rule of thumb, adding those over-refractions in, I try to add as little plus or as little minus in as I can, try to maximize the plus to keep that reading zone better. So with that said, I would think this lens would probably work quite nicely for you. Hopefully that'll center a little bit better, and